Hello, this is Dr. Wells with Wells Medicine, and I wanted to talk about one of the exercises that I use during ketamine treatment to really help people start thinking about what they want to change, how they want to grow, what they want to develop in their new life after they have started recovery from depression or anxiety. And it's really about looking forward and looking to what's next and bringing in what they want and figuring out what they want looks like. So a lot of people will say, oh, well, I want to be happy, or I want to avoid thinking about this, or I want to stop doing this. But I think it's really important, instead of focusing on what we don't want, which is still putting our energy on the things that we don't want to see, on the things that we don't want to bring into the kind of journeying space, to focus on what we do want to create, and what we do want to bring into that space with us. And I think it's really important to consciously map out and design what we do want going forward. And part of that is, so often people will use sort of abstract things like, I want happiness. Well, what does happiness look like for you? Happiness for me might look very different than happiness for you. And I think if you don't know what it looks like, you might miss it as you drive by, or you might not know how to go in the direction towards finding it. I think it's also really important to know um, that often what we're seeking isn't really happiness. Happiness is um, very brief, very fleeting. Happiness is often very not resilient. So often something needs to be added or taken away to find happiness. Often happiness only lasts for a little while, and then we sort of acclimate to whatever has changed in our circumstances that brought us the happiness. So I'll use the analogy often that happiness is the first bite of cheesecake. I love cheesecake, but by the fourth and fifth bite, I don't even want cheesecake anymore. So that's not happiness anymore. If I went to Disneyland once, that might be a happy day. But if someone told me I had to live at Disneyland, I don't think I'd be happy living at Disneyland every day. We sort of acclimate to happiness, and it's very fragile. It's often dependent on other people and other things and our situation. More what I'm trying to bring into ketamine therapy and the journeying is, what does peace and contentment look like? Because those can often be found where we are with what we have and what we're doing. Peace and contentment are more serotonin to happiness is dopamine. They're much more resilient. They're much more stable. They are not really dependent on adding or subtracting anything or changing any facts about people's lives. They're really a matter of perspective and acceptance, and that can be had in any situation. You can find peace and contentment with a cancer diagnosis. You can find peace and contentment in the midst of, hospice situation. You may not be able to find happiness during those things. It may not be, elation at, a parent's funeral, but you can find contentment, steadiness, satisfaction. And I think that's the difference. That's why I really encourage looking for those things and knowing what that might feel like. And often it's found within. So sometimes people will say, well, I won't be happy until my son is happy, or I won't be happy until I get this job, or I won't be happy until I'm a millionaire. But the peace and the contentment are always there, and they're accessible with practice. So that's sort of an encouragement for what I like to bring into the ketamine space, is thinking about, what does your satisfaction, your peace look like, and kind of really planning it out. What do you do hour by hour to have that? What are the thoughts that will bring that to you? How can you practice those thoughts? How are those thoughts accessible to you now? How are the thoughts that you're having disabling your peace and happiness? And how could you change those thoughts without necessarily changing your circumstances? So that's just a little thought exercise for helping to plan for making the most out of your ketamine treatments.